a sense, we're asking the patient to ask the patient what's wrong. We're having a dialogue with the patient's innate intelligence. And D.D. Palmer said, when educated intelligence can communicate with innate intelligence, a point at which the not too distant future may hold, then a correct diagnosis and treatment will be made and rendered. And this is basically what we're doing with muscle testing. We're asking that patient to ask the patient what's wrong. So we as a clinician can make the proper decision as to what to do structurally, chemically, and emotionally for that patient. This particular weekend we're going to focus on the extremities, and I'm going to attempt to show you how important the extremities are to overall body function. I'll be able to fix a TMJ usually totally just by doing extremities, okay? I don't recommend that, but simply as a demonstration. We can have a lot of neurologic disorganization corrected with extremities. I'll show you how fascial flush and Chapman reflex and strain counterstrain can be fixed with extremity adjustments, okay? This is merely for a point to show you that they're very important, okay? Now, even if you think about it on an acupuncture basis alone, all the important points in acupuncture primarily, except for the associated points and the alarm points and the B&E points, but the others are between the elbows and the fingertips, the knees and the toe tips, right? These are the sedation points and the tonification points and the low points and the Shi points and the Sing points and the, Ho points, and these are where those points are. Well, if you have an extremity subluxation, this will create a meridian imbalance, and a meridian imbalance can create a subluxation, which also affects the organ, which also affects the tooth. Okay? So it has a wide-ranging effect, and I want to get started with that, but before we do that, I like to go over, there's about 50 or so conditions that can cause muscle dysfunction, most of which you're probably familiar with, but maybe not quite all of them, so we're going to start with that, okay? And this is not in your notes, okay? So if you want to take notes, it's okay. Now, muscle dysfunction. 1964. Origin insertion. What's one of the problems with AK? The problem with AK, number one, is if you can't muscle test accurately, you can't do AK. If you have a violin, if you can't play it, you can't get the music out of it, right? Okay? What's the other problem? There are so many tools in AK. You have a tool bag that's bulging at the seams that you got to carry around with you. And when you have a patient with a symptom, you have to look in this bag, and you have so many tools, you have to figure out which tool you're going to use at the time. Is it a hammer, a screwdriver, a Phillips head, a flathead, a saw, what type of saw, a sander? You have all these tools. So you have to know when to use what tool, right? Now, here's a basic idea. Let's even back up from that for a second. Or here. Take a history. Right? How many here have been doing AK more than 5 years? And how many have been doing AK more than 2 years? And how many have been doing, and it's okay if you haven't been, I mean, we all started in the same place. How many are doing less than 2 years? It's okay to raise your hand. Okay, so when you teach, when you get to that point, remember the word doctor means teacher, you should be one. When you teach, you have a bell curve, so you have to teach plus or minus 1 standard deviation, and then you have those very experienced, that's over on this end, so you have to not bore them, and then you have these that are more beginning, and you can't lose them either, so you have to kind of play that accordion back and forth. But take a history and decide, number one, was there trauma? Okay? Or is there no trauma, a denial of trauma? If there's no trauma, what would you do? You take the 5-fingered approach. Chapman, Bennett, alarm point, nerve, and cranial, sternal, sacral. So those are the 5, that's the 5 factors. Okay? So no trauma, you have the 5 factors, which we call the 5-fingered approach. All right? Now, trauma, if there's trauma, there's